Welcome, Dr. Schreuder. You are a neurologist, and could you tell us some more about your field of expertise?
Thank you, and thank you for the invitation to come. As you can see, I'm currently sitting at home. I am at home and not in the hospital. So if one of my children enters the room, please excuse me. I'm 30 years old and I work at the Radboud University Medical Center in Nijmegen, the Netherlands. And I did my training in Maastricht. So I moved when I was finished with my training to become a neurologist to Nijmegen. And I worked there with a lot of joy since 2016.
Okay, that sounds good and promising for this interview. So we will now start the interview for the Dutch Brain Olympiad 2022 for the study material. So I will start asking the questions, if my PowerPoint is allowing. Okay, so my first question is, what kind of patients do you see?
Well, I see patients from all kinds of origin, different origin, sex, age, except for children. We have specialized pediatric neurologists to see children. So that's a department I don't usually treat. And we see patients on the emergency department, on the stroke unit, which is a dedicated unit for patients with a vascular problem in the head, so a problem with the blood vessels. And also on the outpatient department, so spreekuur, we see patients who come from the general practitioner, the huisarts, with a complaint.
All right. And what symptoms do these patients experience?
Yeah, I want to tell you about a specific disease which is quite prevalent, quite common in the Netherlands. It's about it affects about 6,000 people a year in the Netherlands. And at the Radboud University Medical Center, we treat about 100 of these patients a year. And it's one of the main subtypes of this dedicated specific disease. And I will tell you about its presentation. So people usually are very ill when they come to a hospital. They almost always are seen on the emergency department. And they can have neurological complaints such as problems with speaking, with moving, problems with their sensations, so they don't feel properly. They can have problems with walking, with talking, with swallowing, and also people can be very. And lastly, in really severe cases, we see patients who can really rapidly progress in their symptoms and even become comatose.
Okay, so the disease has quite an impact on these patients and probably also to relatives.
Yeah, and it does very much.
Okay. And how are the patients diagnosed with the disease?
And like I said, patients usually come to the emergency departments when either themselves or their relatives have alarmed the general practitioner or have called 112, so 112. And these patients, if they have these complaints, these neurological complaints, the emergency staff know that they have to act really rapidly. So the patient is diagnosed with a code A1, A1, which means that the ambulance will come as quickly as possible. So with the siren and with the alarm, and pick up the patient and also move it back to the hospital as soon as possible. So it's the highest priority the ambulance service can have. And at the emergency department, when we get this code, then we are alerted by a special emergency call, and we prepare with the team on the trauma room, we call that. So it's a dedicated room with specialized equipment, and we make sure that the whole team is ready to actually receive the patient. And the team consists of 1 or 2 emergency department nurses who can help us with getting blood samples, with performing an ultrasound or ECG. There's a specialized emergency physician, so that's a doctor who is specialized in emergency medicine. And sometimes we even need the intensive care doctor or a neurosurgeon at the presentation when the patient comes in. And also we call the colleagues from next door, which is the radiology department. And our trauma room is directly adjacent to a CT scanner. So there's one door in between, and we actually move the patient to the scanner. And when the patient comes in, they immediately, they don't stop in the trauma room, but they immediately go through the door to the scanner. And there we hear from the emergencies, from the ambulance staff, what the patient has for medical history, what the complaints are, if they did any checkups of vital signs of blood pressure or respiration or other measurements that they did. And then the neurologist can briefly look the patient. So it's a few minutes. You can check if there's any complaints left or is it progressing. And then before we can do the next steps, we perform actually a CT scan to make sure whether or not this disease is present or not. And a CT scan is the fastest and the most accurate way to detect this specific kind of disease.
Okay, and how do you specifically detect on a CT scan whether a patient has the disease? Is there a certain criteria for it?
Yeah, the CT scan, actually what a CT scan is it's a way to look with X-rays into the patient, and especially in our cases, into the head of the patient. And the disease we are talking about has a specific characteristic on a CT scan. It's really white inside the brain tissue if you make a CT scan. And the other subtype of disease in the early stages doesn't cause any changes in the CT scan. So we really make the scan to see that we see that this disease is present.
Okay, interesting. What are underlying causes or risk factors for developing the disease? Are there any?
Yes, there are. One of the most important things that can lead to this disease is hypertension, so raised blood pressure. And high blood pressure can go unnoticed. You don't feel it for many years. And that is really tricky because you can have high blood pressure, and if you don't measure it, you don't know that you have it and you won't be treated. And this high blood pressure can slowly damage really small blood vessels in the brain. And we think that this damage to these small blood vessels can result in leakage of the blood vessels. And that's ultimately the step to developing the disease in question. In about 70% of the patients, hypertension is the key factor that leads to this specific disease. Then there's a smaller group, about 20% of patients who have a different kind of damage to the blood vessels. And then it's not hypertension that causes damage to the blood vessels, but it's accumulation, so the leftover of a specific protein in the blood vessels. And this protein is called amyloid. And we also know that from other diseases, this protein can have an effect on blood vessels or brain cells. And again, having this protein in the blood vessels make the blood vessels really prone to leak and eventually result in the disease we're talking about. And lastly, if you have counted correctly, we have 70% of patients who have hypertension, 20% of patients who have amyloid angiopathy, and then about 10% of patients who have an abnormal blood vessel, which results in leakage into the brain tissue. So that's the minority of patients.
Okay. And regarding hypertension, if I understand well, you would advise people from a certain age to regularly check their blood pressure levels, right?
Exactly. Yeah. If you don't check your blood pressure, you don't know what your pressure is, and you can have high blood pressure for many years. And it's not just me, it's even the Dutch Heart Foundation, who last year had a really big campaign and to alert people to measure their blood pressure. And you can either buy a blood pressure device yourself, which is not that expensive, about 20, 25 euros, or you can make sure that you go to the general practitioner, and you don't have to do it every week, but just once a year, measure your blood pressure and make sure that it's okay. And of course, you youngsters don't have had the risk of having high blood pressure already. It's usually about the age of my age, I'm 38, so about the age of 40 that you need to be aware and should start measuring at least once a year your blood pressure.
Great, that's clear advice. And my fifth question, what are current treatment options for preventing or treating the disease?
So preventing the disease, we already discussed a bit. It's blood pressure, and blood pressure. That's the most important thing you can do. And treating this disease is really disappointing, but there's really little we can do if a patient already has this disease. We can admit patients to our specialized wards. We call it the stroke unit, where we can take care of the patient, prevent that they have any complications, for instance, a pneumonia, or get a disease otherwise. And what we can do if a patient comes in and he has high blood pressure, in the first few hours, we can actually lower the blood pressure and slightly improve prognosis, but that's not really a big effect. And because we have really little we can do, about 40% of patients who come in hospital are dead after 1 month. So that's a really high number, and we really hope that we can improve that over the next few years. We think that there's many developments in our field, and compare it with the other type of disease that you can have in the brain vessels. There is really much going on in the last 20 to 25 years. Many things have worked, and prognosis there is much improved. But for this type of disease, the advances are really limited up to date. And what we're hoping is that we actually get a new treatment within the next few years. And even in the Netherlands, we are going to test, as of this year, a really important treatment to actually make sure that we can help our patients. So in the end, prevention is the key, and it's really about checking your blood pressure and trying to treat it if you have high blood pressure.
Okay. Then I have prepared a final sixth question. Are there any indications that artificial intelligence can improve current diagnostic tools?
Yeah, AI is really hot in any kind of any kind of technological profession that you have, and especially also in medicine. There's much to do about it. And you can think that there might be several things that could help our work as a doctor. For instance, making sure that you have the right diagnosis is an important one, and we and many others in the world have developed AI strategies to actually help diagnosing the disease really quick, or measuring how large the disease is in the brain, or finding other criteria that can help you actually select the right patient for the right treatment. As I said, there's currently not much that we can do to these patients, but we hope with new treatment options that might come available in the next few years, that we can also have a really smart computer helping us to guide which patient could benefit from this treatment and which patient we might need not to use and that kind of treatment.
Okay, so that's really promising for the future.
Yeah. Yeah.
Okay. Well, thank you very much for this very interesting interview.